Good evening everyone. So back for another Facebook Live, and today we're going to be talking about the things you should and should not do before coming in to see your chiropractor for your normal regular appointments. Now of course, hopefully your chiropractor will already explain during your consultation some of the things that you should do or you should not do before coming in. What we're going to do is give you an idea of some general guidelines that would be good for you to do or to not do, again, before coming to see your chiropractor. And then also some of the things that we have more specific within our own practice here at Vitality Chiropractic Centers. So some of the things you generally should not do before going to see a chiropractor would be things like exercising too soon before, having any pain medication, and trying not to do anything which may have an effect overall on parts of your nervous system, say by like having cigarettes or maybe a big cup of coffee before going in. The reason for this is because if you do these things, it will have this effect, like I mentioned, on the nervous system, and any kind of testing that your chiropractor is doing will then start to be affected potentially by what's happening. One way to think of this is kind of like, say, sorry about that, say if someone has a double espresso and they go in and they get their blood pressure checked, it's going to have an effect on their blood pressure. And it'll be the same thing before going into your chiropractor. You should avoid doing these things. So get back to the first one I was talking about. We were talking about the first two, which were exercising and of course avoiding these kind of chemicals you're having as well. So try not to exercise before going in, because especially if you're working on certain muscle groups, it may make those areas more tense and it may make it more difficult for the chiropractor to either, number one, do adjustments accurately, or number two, to assess properly where they should or should not be doing adjustments for yourself. And the other thing as well is to make sure that, just for personal hygiene issues, that you're not going to be exercising just before going in. Nobody wants everyone to be coming in really sweaty and affecting them when they're coming in. And then, like I mentioned, the other things really to avoid would be things like, say, coffee, caffeine, making sure you're avoiding cigarettes or any medications before coming in. I'm not saying you can't have these things, but not too soon before coming in, because it can start to have an effect on what's happening with your nervous system. So in our practice here in Vitality Chiropractic, we really make sure that we want to make those accurate specifications and checks on our patients before we ever do any sort of adjustments or treatment, so that we will get the best results for them. One thing that we use is a device here. This is what we call a Titron. So this is a very specific type of technology, and this is what we call computed thermography. And computed thermography is a very sensitive measure of what's happening in the nervous system using infrared technology at a very, very acute level. So what this will be doing is testing what's happening in the nervous system to see if there's any sort of problems, and if there is, this is how we know we should be helping our patients and when we should be doing some sort of adjustments for our patients. For ourselves, because things are so specific and technical, we need to make sure that before our patients are coming in, that we have at least 2 hours where there's no coffee, no other types of caffeine. There can't be any medications, especially ones which will be suppressing things such as parts of pain or the nervous system, and also avoiding things like smoking and cigarettes, because they may have nicotine which is going to be spiking in the nervous system as well. Again, not to say that our patients, they shouldn't be doing these things. Of course, we want them to do healthier choices, but really before coming in, they need to avoid doing these things, because it will then start to affect. Also, ideally, if possible, it's good to not just come straight in and see a chiropractor, not just because you may be warm, but because it may actually be in more of a tense state, especially if maybe you're coming from a stressful situation, or just because your muscles may be tense from the activity you're doing. So it's always good to have some time to rest, relax, and at least in our clinic, because we are using thermal kind of technology, it's good for our patients to have some time to let the body cool down and acclimatize before we ever see them. So as a standard protocol for all of our patients, we have to have time in the waiting room of around 10 minutes to make sure that the scans we use with our Titron are going to be as accurate as possible, and to make sure that we're going to get the best scan for them, so we know if we should or should not be adjusting. So if you have any other ideas of things you think you should or should not be doing before going to a chiropractor, put them down in the comments. And if you have any questions, you can always send us a message at help@vitalitychiropracticcenters.com, or you can WhatsApp or call 8438 9550. Have a great evening, everybody.